Urinary incontinence don't have to wake up wet. Wake up dry with the PureWick system, an innovative breakthrough system for managing female urinary incontinence at night.
Morning, Mom.
Good morning. How did you sleep? Better, thank you.
Thank you all for joining with us.
All right, Sharon Melton here with CW39 Houston. We're interrupting your regularly scheduled programming for a news conference from Governor Greg Abbott at the state capitol. Let's listen in.
The number of new cases and new hospitalizations have been cut by more than 2/3. Just yesterday, we had the lowest number of hospitalizations in the past 3 months. And importantly, the number of people recovering from COVID continues to skyrocket. Doctors have explained that the biggest reason for these improvements is because Texans are taking COVID seriously. People are following the CDC standards, social distancing, sanitizing their hands, and wearing masks when around others. Those safe practices remain the best defense against COVID until vaccines arrive in the coming months. These practices are particularly important now that students are returning to schools and colleges, now that fans are returning to sporting events, and now that flu season is upon us. Personal vigilance is the best way to keep down the number of COVID cases, the number of hospitalizations, and the number of fatalities. Now, while we go about protecting Texans from COVID, we must also be mindful of those who are suffering from the pandemic in other ways. People who are enduring family hardships and unprecedented financial challenges. But now, with the medical advancements that we have made and the personal hygiene practices that we have adopted, Texans have shown that we can address both the health and safety concerns of COVID while also taking careful and measured steps to restore the livelihoods that Texans desperately need. Achieving both goals requires a framework that establishes safe standards that contain COVID, that emphasize protecting the most vulnerable, and that establish a clear metric that the public can depend upon. First, let me mention the safe standards. Until additional medical treatments are available, we must continue the safe practices that slowed the spread this summer. That includes staying at home if you're sick, sanitizing your hands, maintaining safe distances, and wearing a mask. Those personal behaviors will continue to slow the spread while opening schools and while adding jobs. Safety will also be enhanced with a massive increase in testing. Texas is scheduled to receive millions of these 15-minute tests per month that will help Texans know immediately if they have COVID. We can also reduce fatalities by remaining focused on protecting the most vulnerable. Most deaths are people over 70. Half of those are people over 80. We can save more lives by continuing to shield our seniors from exposure to COVID. Now, to determine if we are progressing on the right path or if we need a course correction, we need a fair and reliable metric. From the very beginning of this pandemic, doctors have said that COVID must be slowed to ensure that our hospital capacity is not overrun like what was seen in Italy and places like New York as well as other places. Hospitalizations is the most important information about the severity of COVID in any particular region. It is also the most accurate information available on a daily basis. Remember that no doctor has ever suggested that the goal is to eradicate 100% of COVID cases. That is impossible, even after vaccines become available. The goal has always been to contain the disease, to limit its harm, and to maximize the healthcare system's ability to treat both COVID patients as well as other medical needs of the community. So the way this works is this. When COVID hospitalizations are high, it means that the spread of COVID is excessive in a particular region and that corrective action is needed. When hospitalizations are low, it means that COVID is better contained in that region and that businesses can reopen. This metric is particularly effective because it distinguishes the severity of COVID between one region of Texas from others. The fact is that not all parts of Texas are impacted the same by COVID. A high level of spread in one part of the state may be completely irrelevant to the COVID condition in another part of the state 500 miles away. An easy example shows why. Amarillo is closer to Kansas and Colorado than it is to Dallas and Houston. It would be more affected by the COVID condition in those states than in other regions in Texas. As a result, the severity of COVID in one region of Texas should not dictate the business practices in some far distant region of the state. So moving forward, we will continue to consider all of the relevant factors for additional business openings or for course correction as needed. But we will rely most heavily on hospitalizations of COVID patients in the 22 hospital regions in Texas. Doctors and hospitals suggest that it can be a warning if more than 15% of hospitalizations are of people with COVID. Hospitalizations above that level signal a serious spread and begins to compromise a hospital's ability to respond to COVID. More specifically, if the COVID hospitalizations are less than 15% of all hospitalizations for 7 consecutive days, then the region is safe enough to allow additional openings. On the other hand, if COVID hospitalizations rise above 15% for 7 consecutive days, then course correction is going to be needed. That correction would likely mean that it would require a reduction in the extent to which a region is able to open. To explain how this works, we present this chart to you. This chart shows the 22 hospital regions in Texas. If you look on the left column, it shows the 22 hospital regions across the state. The middle column shows the peak percentage of hospitalizations of people with COVID in each region. You'll see that 20 of the 22 regions peaked above that 15% metric. In 5 regions, more than half of the people hospitalized were hospitalized with COVID. The right column shows the status today, and you can see how remarkably we've been able to contain the hospitalizations in so many regions across the state. But even with hospitalizations plummeting, 3 regions remain in the danger zone. One is the Rio Grande Valley, another is Laredo, and the third is Victoria. At this time, that level of COVID hospitalization shows that COVID is still spreading too much for those regions to be able to expand their openings. So we will continue to work with those regions to help them better contain their COVID spread, as well as to help them lower their hospitalization rates. The other 19 regions are able to open at the expanded capacity announced today. However, before going over the new standards, let me make 2 quick points. First, for months now, most businesses have been able to open at a 50% capacity. Actually, some with no capacity limits whatsoever. The extent to which Texas has been open is reflected in the plummeting unemployment rate. At the end of April, it had soared to almost 13%. By now, that number has been cut almost in half. During that time period, more than 500,000 jobs were added. So substantial improvement for the Texas economy and for individual pocketbooks is already underway. The second point is that there are some Texans who want to fully open Texas 100% as if COVID no longer is a threat. The fact is COVID does still exist, and most Texans remain susceptible. If we fully reopen Texas without limits, without safe practices, it could lead to an unsustainable increase in COVID that would require the possibility of being forced to ratchet back down. The better approach is to safely take strategic steps that help Texans return to jobs while also protecting them from COVID. And that is what we are announcing today. For the 19 hospital regions where COVID hospitalizations are less than 15% of all hospitalizations, the following business categories that currently have a 50% capacity can increase to a 75% capacity. That includes all retail stores, all restaurants, all office buildings, all manufacturing, all museums and libraries, and all gyms. Those openings can begin as early as Monday, September the 21st. Also, effective immediately, hospitals in those regions can return to ordinary elective surgical procedures. And additionally, all nursing home facilities, assisted living centers, state-supported living centers, and other long-term care facilities are allowed to reopen for visitation. They must, however, comply with certain health protocols, and there must be no COVID outbreak at those facilities. All of those facilities are now allowed to offer essential caregiver visits. To give these facilities the time they need to prepare for the additional visitations to begin, they will be allowed to open up next week, September the 24th. Because bars are nationally recognized as COVID spreading locations, they are still not able to open at this time. However, it is important for them to know that we are focused on finding ways to get them open. We need to see COVID numbers continue to be contained, and we need to work with the bars on effective strategies that will ensure that when they do open, the possibility of spread of COVID is contained. Some bars and their associations have offered some very helpful ideas, and we will continue to work with them on that process. Let me end with this. Without vaccines available containing COVID is a challenge, but Texans have already shown that they are up to that challenge. The reality is that COVID hasn't suddenly disappeared in Texas. It's still here, and it's still a threat. But we are now armed with the personal safety standards and some medical advancements that can ensure that we can continue to tame COVID until more treatments and vaccines become available. So as we go about the process of continuing to contain COVID, we will also continue to work to open up Texas. Now I'll hand it over to Lieutenant Governor Dan Patrick.
Thank you, Governor. I know this is welcome news to everyone watching and all of the business owners out there.
This is really big news when it comes to COVID-19 here in Texas, as you've been listening to Governor Greg Abbott talking about the revealing the next steps in reopening Texas to the public. This is really big. What he is basically stating is that there are 22 hospital regions within the state. 19 of them are meeting the current protocol of having at least less than 15% of hospitalizations of COVID-19 cases. So because of that, and because of his discussions with his health department, he is now stating that if you have a business such as a retail business, restaurants, museums, other businesses, etc., if you're currently at 50% of an increase of capacity, you will be able to increase to 75% capacity for your particular businesses. That will begin this Monday, September the 21st. Now, for hospitalizations, if you have ordinary elective procedures you were supposed to be doing at hospitals, they are now allowed to do that with certain protocols in place. And a big one for those people who have loved ones in nursing homes who have been demanding to see them for all this time, but visitation was not allowed. Beginning September the 24th, you will be allowed to visit these nursing homes, long-term facilities, as long as there are no active COVID-19 cases in those facilities. So you'll be able to contact and visit your loved ones who many people have said they desperately wanted to see. And finally, that'll begin on September 24th. And finally, unfortunately, when it comes to bars, because they are such public places, they will not be allowed to open just yet until more investigations are taking place and more when it comes to COVID-19 and more testing is done, but they just feel that it is just not the right time to allow those bars to open. So once again, Monday, September 21st, going from 50% capacity to 75% capacity for retail, restaurants, museums, and others that are listed in his recommendations, along with ordinary elective procedures at hospitals will take place, and nursing homes and long-term facilities will be open to visitors beginning September 24th. And they'll continue to look at the bar situation, but bars at this point will have to remain closed. Now, of course, we'll continue to follow all of this. You can always join us on CW39.com for all of this information. We are continuing to broadcast this live as well on our website. And of course, we'll continue to have more on these developments when it comes to reopening Texas here when it comes to COVID-19 and the coronavirus. Of course, thanks for joining us for CW39 Houston, and join us in the morning for CW39 Houston No Wait weather and traffic starting at 6 a.m. till 10 a.m. Have a great day, everyone, and take care.